Welcome, everyone. I'm Dick Deming. I'm Medical Director of MercyOne Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. And I am just so happy to introduce you all to a friend and colleague of mine, Dr. Charles Goldman. Welcome, Charles.
Thanks. Good to be here.
Charles grew up in New York City. City so nice, they named it twice. He got his undergrad degree at Brandeis University in Boston. Went to medical school at WashU in St. Louis. Did his surgery residency at WashU, and then went to the University of Minnesota for a surgical oncology fellowship. And practiced surgical oncology for many years. And in fact, we were colleagues for probably 20 years or so with Charles as a surgical oncologist. And then a few years ago, he went back to training and did a fellowship in palliative care and has directed the palliative care program at MercyOne since returning from his fellowship at the University of Iowa. Welcome, Charles.
Welcome, Dick.
So we're going to talk a little bit about palliative care, and Charles has already spoken with us about that, and he has an interest in something that we're learning more and more about, and that is the use of psychedelics in a medical circumstance, medical situation. So we're going to talk about psychedelics today.
Yeah, and I think this is probably a very apt time to do that because I think many people have noticed all of a sudden there's articles in the New York Times about psychedelics. There's a certain small number of venues that have legalized psilocybin, otherwise known as magic mushrooms, for use or at least decriminalize them. And what is quite fascinating is that one of the two areas where psychedelics re-entered the medical mainstream, although they're not yet, you can't really use them yet outside research protocols, were in the arena of end of life, particularly in cancer patients. Some of the issues of anhedonia with end of life, loss of any sort of pleasure, people coming to the end of their lives and wondering what was the whole point. Also, people in survivorship realms in cancer who have developed such a phobia and a fear of recurrence, no matter how much we can give them the statistics and the information, they've essentially, and I want to be cautious in using this term, they've essentially developed a civilian form of PTSD. And my brother, who's a psychiatrist, will probably be going crazy in my use of this because we've made PTSD such a generalized diagnosis now. But nevertheless, as you well know, there are patients we cannot convince, no matter how many scans you could offer them, that the cancer has not come back. So that group, and then also for profound major depression and specifically PTSD, particularly military type PTSD. And I think that, one of the things that would be interesting to go back a little bit with psychedelics, and one of the things that as I've gotten more into the field of training to potentially be able to bring these back into the therapeutic environment, is why are psychedelics on Schedule 1? And what is even Schedule 1?
What's Schedule 1?
Right. So Schedule 1 are medications that the FDA/DEA determined, unfortunately back in the 1960s for reasons we'll talk about, did not have any clear therapeutic value.
Yeah. So FDA is the Food and Drug Administration, and DEA is the Drug Enforcement Agency, I think.
Administration, I think it's also, yeah. So, what happened is that people may not know this, but psychedelics were not illegal for use into the mid-1960s. There were a number of experimenters, some of them authors, some of them, psychiatrists themselves, I guess most notably Timothy Leary at Harvard, who believed that at that time, particularly LSD, to a lesser degree psilocybin, some mescaline, had value as an adjunct to therapeutic interventions for depression. And remember, at that time, people were still doing electroconvulsive therapy for major depression. But what happened was that psychedelics, unfortunately, got associated with probably the seminal event, the Manson family murders out in California. And it came out as part of the trial that Manson was basically dosing his family, his followers, with LSD almost every day, and that it tended to increase their suggestibility and the idea that that's why they were following Manson.
Wow.
That plus the association with hippies, for those who may remember those times, and the law and order focus of the 60s, especially once Nixon became president. So one of the things, especially with COVID, where we talked a lot about follow the science, there was no science for putting psychedelics on Schedule 1. It was all political and just a react and a morality kind of morality.
Let me ask you a question about THC. And this might not be the right term, but the psychoactive ingredient in cannabis.
Yeah.
Does THC fall under the category of psychedelics?
Well, the definition of psychedelic is not well defined, but the type of experience that the drugs that are classically called psychedelics engender, THC at the level that's usually available in cannabis is not considered a psychedelic. In the same sense that, for instance, a drug we do use, ketamine, which is now also approved for use in depression as a nasal spray, is a dissociative agent. And THC is more of a dissociative agent, which is that it doesn't sedate you in the sense like opioids do, but you are dissociated in the sense that you're not totally aware of your surroundings in a comprehensive way. Psychedelic drugs have what we would say an expansion of your consciousness, or in some ways, and this is what's interesting about psychedelics, and this is why it's interesting even as essentially what's going on with psychedelics now is that it is both being looked at as a therapeutic tool, as well as it's an amazing research tool. And it's an amazing research tool for us to really delve into what is consciousness, and that's a lot of what's going on around this, is that it's not just about going to Burning Man, or to try to enhance creativity, but it's also it's truly an investigation to what our consciousness is. So
when you put when a drug is on Schedule 1, correct me if I'm wrong, you can't even do the ability to even do research on it is very limited, correct?
Yeah, it's really interesting because that's what happened to cannabis, which was that there was one government facility that was growing cannabis for a small number of people who were given compassionate use for it, and also to allow for some research on cannabis in the United States. But here again, for political reasons, for the most part, cannabis research was mostly going on outside the United States. Mm-hmm. Interestingly, with the psychedelics,
because the United States put it on Schedule 1.
Well, but also just because of the association of marijuana with Don't Say No and all these other things. The psychedelics, on the other hand, although they had much more opprobrium attached to them, like the scrambled egg. Remember the, this is your brain on drugs. Yeah. Right. So, I mean, if you look at that, they're clearly talking about psychedelics, right? Just Say No was kind of opioids, marijuana, including psychedelics. But really that I don't know whether it was intended to be that way, but that marketing of the, drug abstinence was pretty clearly about psychedelics. And so in the 90s, when a group of researchers said, we want to be able to go back to what we started in the 60s and compare these drugs mostly in depression situations to the standard SSRIs, SSNIs, that people generally use.
And those are that's a class of medicine used to treat depression.
That's correct. It's the predominant one that's used, around the world now. I mean, there were older agents, monoamine oxidase inhibitors, and tricyclic antidepressants, which still do have value, but the concern with tricyclics was their increased use as in suicides. You could very much overdose fairly easily on a tricyclic. It'd be much harder to do on these other medications. So the psychiatric community said, we like to compare these drugs, these psychedelic drugs, looking at the signal that was already being generated by the research back in the 60s, and compare them head to head with our present antidepressants, which, as I think everyone would admit, are active, but really have so many side effects themselves that using psychedelic agents, as it's turned out, doesn't require you to do it perhaps more than a couple times to have a true psychedelic experience, not just as dissociative experience, but the true psychedelic experience. The protocol that actually may bring, for instance, MDMA, which is known recreationally as ecstasy, out into actual controlled use, has shown clearly that with a setup of about 3 months of gaining familiarity with the patient, sort of finding out what are the reasons for their PTSD, perhaps, just traditional interactions, psychiatric interactions with the patient, followed by 3 sessions guided by at least
3 sessions of MDMA.
Of MDMA
administration.
Right.
That's oral, correct? Or?
Yes. Yes. Mm-hmm. And yeah, all of these are delivered orally. So 3 sessions with the MDMA, and then follow on back into sort of the traditional psychiatric scheme, that there were people who had been diagnosed with PTSD for years who didn't take another traditional antidepressant for many years after. So there's an actual rewiring of the brain by these experiences. And a lot of the situations that have gotten psychedelics a bad name have been recreational use, because recreational use of psychedelics is associated with about a 30 to 40% reporting of significant, although temporary, sort of psychological concerns. About 5 to 7% of people, and again, this is in a recreational setting, will develop significant longer-term psychiatric issues that may be attributable to that experience. But that's an important thing, which is that what we're talking about here is not just, although unfortunately this is what's going on, as I just kind of read you my text from one of our compatriots about the 4 women who went over to Colorado and met with an Episcopal priest and a shaman, and then took psilocybin with them, or sat with psilocybin, as they would say. That's really not the way it should be used, nor should it be used ecstasy at a rave, which is hyperexcitatory, nor should it be used in a recreational setting in a burn for somebody who's inexperienced, for instance, with psychedelics. But used in a controlled setting, maybe not necessarily controlled by us physicians, but at least having some standard and having some follow-up and having some sort of dosing protocol. These agents have shown themselves to be extraordinarily effective.
And maybe it would be useful. I know it would be useful for me, even though I have read it and I've watched a Netflix documentary to sort of talk about the different ones. And obviously some of them, the plant-based ones, have a cultural heritage and go back into indigenous people using them for ceremonies and for cultural or religious purposes, and that comes into play sometimes too when you talk about, well, should white folks be using peyote in clinical trials, or is that something that's like the host in communion that we shouldn't let people just experiment with because it has this cultural affiliation?
Yeah, that's a fascinating question, because, in fact, as you know, I'm training with a entity out in California, an integrative studies entity, which is training mostly psychologists and psychiatrists, but some physicians of other specialties in the use of the agents, but at the same time, some of the very questions you're asking, which is this not another form of cultural appropriation? So, for instance, the one probably where that's most true is ayahuasca, which is a Amazonian, Central American combination of, it's a tea made from two herbs, and the proportions are known only to those who are the practitioners of this. And they that actually is the only one of the psychedelics that can be used legally in the United States. Now, not legally in general, but if you remember back to 1993, there was the Religious Freedom Restoration Act, of course, which was totally misnamed because it was exactly the opposite. But nevertheless, one of the ironic results of that was that there was a case in 2006 in which a church known as a Native American, basically a Native American church here in the United States, known as the Unity of the Plants, went before the, at that time, Roberts Supreme Court, but not the one as conservative as this one, and basically said that this was a sacrament of their religion, and they won. So, and what you're seeing now is that there are other entities that do qualify as churches that are also using that exception to administer ayahuasca. So yes, that's partially a problem. The other problem, of course, is with psilocybin, is people now that, particularly like a place like Oregon, they're going onto Native American lands to harvest these, the mushrooms, and or in the case of peyote, which is nowhere near as well studied as ayahuasca, LSD, MDMA, and psilocybin, and they are. So what may well happen is that LSD is synthesized, so that's going to be a pharmaceutical. Psilocybin can be also synthesized, and actually most of the research that's being done in allopathic, for the most part, tertiary, institutions, has been done with the synthetic form of psilocybin. So that also probably be marketed. MDMA, same thing.
Yeah, obviously, there's one thing about, well, the natural plants and eating the plants, but in terms of science, the dose you're getting is variable when you're eating a plant that contains the substance, as opposed to isolating the substance, purifying it, being able to know what dose you're giving and putting it into capsules, as opposed to eating the plant.
That's true. But what's interesting is many people feel like that part of the acceptance, part of this, what we call the setting, is to imbue even the synthetics with that same sort of respect. I mean, I know a lot of this sounds, it's certainly about it couldn't be more 180 degrees away from being a surgical oncologist. But
well, it is, we're in a weird time that even in the state of Iowa, the legalization of medical marijuana came about because of a Republican governor and a Republican legislature, and it's sort of strange bedfellows that's happening with this, the arguments for even cannabis, recreational cannabis, which we don't have in Iowa. We did, but for anyone watching, we did a show a couple weeks ago on medical marijuana in Iowa, but you can learn about how that came to be. But obviously, Colorado and many other states have recreational, and it's still federally illegal, but
right.
I don't know how many states have made
it's
it
like
legal.
20, it's 27, I think,
which
already.
Makes it very difficult to do research, and very difficult to have nationwide laws. You can't legally take it across the state line because that it's federally illegal. Well,
Right.
maybe why don't we talk about? I think you have a slide that shows the various drugs
Mhm.
or plants that we're going to talk about that
Yeah.
fall into the category of psychedelics. So
Sure.
let's bring that up. I think that'd be helpful. Some of these,
Yeah, I have to say, normally I don't lecture,
yeah.
but that's why I only made about 11 slides. And oftentimes when I make a slide set, I never get past the second one.
And
But
this is the famous commercial that any of us who grew up in the 60s would have seen.
right. Well, you didn't put my disclosure slide up there, which is that none of what we're talking about is legal in Iowa at this point.
Okay. We can go to the next slide.
We can go to
George.
the next slide. Okay. So we'll get back to this picture again. And I think, yeah, what I'd like to get back to is the idea that while the media and I think even much of the research establishment around psychedelics is most interested in what's the pharmacology, what's it going to do for me, the fact of the matter is that psychedelics is a window into understanding consciousness. Now, consciousness, what we assume is consciousness is waking consciousness, right? What we see, what we sense. But a lot of the fascinating things about psychedelics is to read through those who've written about it in maybe a bit more expansive way. Also, the interesting thing is many of the researchers are very experienced themselves in taking psychedelics and have been doing so for a long time. And I'm not talking about that they're like lay researchers. They are scientists, and they are people who felt, especially if they were going to do this kind of research, they needed to experience something of what's happening when you do ingest a psychedelic. So, I mean, if we can go back to this. So this is something you'll see a lot of times when we're talking about psychedelics. Dick and I were talking. He read Michael Pollan's book, Change Your Mind. Netflix, of course, popularized that with a documentary, which I've not yet seen. But this is the point of this is that if you look on the left, that is the sphere with a modest number of connections. This is your brain for the most part. Most of the time, this is waking consciousness. And, I mean, I'm sure, people out in the audience probably heard we used about probably less than 10% of our brain function. Some people, I think, probably using less than that, but nevertheless,
they'll go nameless.
Well, we know,
yes, during this lecture.
That's correct. We will not, you can just insinuate who I'm talking about. So the point here is that why do we only have 10% of our brain working at a time? So the first thing to think about in terms of the brain is our brain is a cobbled together brain. Okay. It is not, this wasn't formed as a unit, as the great naturalist and essayist Stephen Jay Gould used to say, we're just cerebrated apes. And we know that the brain is stratified in terms of the automatic functions, and a lot of what we call the lower functions are old, and that's the base of the brain. And then we put a big cerebrum on top of it, which was highly energy requiring. So you can't have your brain at all times working 90%. It's kind of like what we see with the DNA in our bodies. A huge proportion of it is silent, but then at times it seems to turn on and influence the small percentage of the gene that actually is working most of the time. Our brain is no different. And so the thing that psychedelics does is that it damps down the modulator of our brain. There's a part of our brain that I'm blanking on something. Sorry, I'm gonna have to look at my piece. Oh, that's right, the DMN. The DMN is the default mode network. So the default mode network is the left side of this illustration, which is I have to work in this reality. I have to work in my waking reality. I can't be off, in the other 80%, who knows where, when I'm supposed to be, especially if you're doing surgery, people want me in my default.
I got to be here now.
You got to be
right
pay
here. Attention to this.
Right.
And if I'm just seeing colors.
Right. And we also, for consciousness, need to be able to distinguish ourselves as a unit separate from others, but at the same time integrated with others. So that's where the cobbling together starts, which is that the default mode network is actually a late evolutionary change in the brain. So, for instance, the move toward consciousness, rationalism, those sorts of things that we all celebrate is actually a late evolutionary change in the brain. So there's a lot of our brain that is not accessed for most of the time, except during adolescence, when, of course, this thing's firing off that, who knows, we never see it fire off again. So what happens with psychedelics is that they make accessible the part of the brain that we normally we don't even just ignore it. It is just completely suppressed by this default mode network. The default mode network, for instance, is so important that it is the highest flow portion of the brain.
Where in the brain is that?
That part.
Okay.
You're asking someone who something.
But I'm an end user. So it's a bit of a governor that keeps. I'm governor in the sense of like a motor.
That's correct.
It keeps it from going too fast. Keeps most of it turned off so you can focus.
That's correct.
And also psychedelics release the governor. Really allow.
That is the effect of at least two of the psychedelics we know for sure do that, which is LSD and psilocybin. Whether MDMA
has that been looked at like in a functional MRI?
Yeah, functional MRI and other sort of
somebody
brain
is in
flow.
an MRI scan getting an MRI done as you're giving them the med, and you can see different parts of the brain light up. So
that's correct.
Without the drugs, a pretty quiet brain, and then this is your brain on LSD, and whoa,
right. So it's not scrambled eggs. It's actually highly interconnected, and it opens up connections that you normally would ignore. And one of the things that happens in a psychedelic experience, which is what's different from a dissociative experience, is what's called ego dissolution. Because one of the things that is clearly residing in the default mode network is your ego. And the ego is, controlling, as we all know, many things. Our ego gets in the way of a lot of things because what it's trying to do is keep us on task. What's also going on is that we learn to shortcut our thinking, right? As we go along, I mean, I don't know if anybody's read, Fast and Slow Thinking by Kahneman. He was a behavioral economist who won the Nobel Prize in, I think, 2002. Gladwell's Blink. We learn shortcuts, which is to take the input very quickly, say, this looks like this, so this is how I'm going to act. This is all what the default mode network is doing, because it's trying to keep us from expending all this energy, lighting up the rest of the brain that we don't need to function from day to day. The problem becomes that we get ossified in that pattern of thinking. And, many of the great scientists and philosophers and thinkers did the majority of their work before they reached the age of 35 or 40. And it's not because your brain, starts to shrink or anything else. It's because the learned patterns are exactly what has become evolutionarily predominant in our brains.
So it's harder to have new thoughts.
It is harder to have, exactly.
You're so ingrained in having the same thought over and over.
Right. So we give it the name of wisdom to kind of make it seem, which it is. It is. And
you know what you know, and you know it better.
Correct. And that does have value. I don't want to devalue this, but it's really important to understand that there is so much brain there. And just like the gene, I mean, the similarities with the genome are really pretty fascinating, because much of that, quote, silent genome is made up of insertions by viruses, is made up of ancient DNA that somehow has not become useful anymore as the gene has evolved. It's the same thing with the brain. The part of the brain that generally is inaccessible to us is what we consider the more ancient lower part of the brain. And what's in there are things that we would think we would want to bring forward, but in terms of efficiency, it doesn't make sense. So for instance, imagination is actually an older function of the brain than ego would be. So now you would think we'd want to be imaginative, but the problem with imagination is when you, again, are on task, do you want to be going off on some sort of tangent with your, like thinking about where you were 20 years ago or something? Because it's also, imagination is very much linked to memory. So the DMN suppresses these communications. And then when you take psychedelics, or they've done it with meditators, I can only imagine trying to meditate in the middle of a functional MRI. You have to be really good. I'm a terrible meditator. But people who are very adept at meditation are able to do the same thing to the DMN to essentially suppress it, so they too can get the same place. Psychedelics are basically a shortcut to a place you can get. People who are fasting can get there. Perhaps chant, like Buddhist chant, that sort of repetition, Sufi chant, can maybe also engender that same state. Prayer, perhaps, other types of prayer. But the point is that, and again, this is just fascinating to think about, is that we have prioritized our waking consciousness evolutionarily at the cost of other forms of consciousness. And that what's happening with psychedelics, or some of these other ways of doing this, is to bring forth these more, quote, primitive parts of our brain. And that's what we're experiencing.
Parts of the brain that we day-to-day just don't use.
Right. And what the other side of this is, there's a theory of the mind known as bicamerality, which was a psychologist, I think at Princeton in the 1970s, by the last name of Jace, wrote a book about the bicamerality of the brain, basically saying that consciousness is a late evolutionary sophistication, that even early humankind basically was living in their pre-language left brain, and that the left brain is where resides a lot of our visions of perhaps God, of augury, the auguries, the oracles, and all of these things. And that with the invention of language, it allowed the right brain, the speech centers on the right, to essentially suppress the left brain. But here again, you have this latency of what's in this left brain. It's not gone, it's there. And it's passed on from human to human. And so, I don't know, sometimes science fiction is a great place to go for like wild ideas. So for instance, one of my favorite books is a book called Childhood's End. It was the book that Arthur C. Clarke wrote before. Childhood's End. It was made into a movie, a TV movie, I think. It's a book written before 2001, which became, of course, this huge Kubrick movie. And in Childhood's End, his supposition, I think at this point he was living on some mountain in Sri Lanka, Clark, was that there are certain images, religious images, that are fairly uniform from culture to culture and place to place. For instance, the image of Satan is fairly uniform. And so what happens in Childhood's End is that we have the devil represents, in this science fiction book, the aliens who dropped us off, basically. This whole alien theory is very big right now, but this was way back in the 50s. Clarke writes this book, and that's what he's saying, and that may be the case, is that what we see in these more primitive parts of our brain, and what people see when they have these psychedelic experiences, is simply recollection of something that is there because in some either actual or metaphorical way, we did experience it deep in our
and then there's some thought that past experiences can be transferred to future generations through genetics or epigenetics.
Correct.
And let's move on,
sure,
because we're running out of time, and we haven't even gotten to name the psychedelics yet.
Oh, okay. So sure, go ahead.
Let's go to the next slide. And
I'm glad we only have 11 slides because
Here we go. Here are the psychedelics in the pipeline.
Right. And these are the ones that are having the most research done. I would say pretty much in order of when they might become normalized, so to speak. So MDMA has the most research that's been done on it. It is proven extraordinarily effective.
Where did it come from? MDMA.
It's a synthetic. It's a synthetic.
But was it created?
I don't
think.
I don't think it. I don't believe. I have a little cheat sheet here. I don't believe it has any.
Remember. It's not one found in a plant, and
it is not. It's not.
This
it's
is
not
the one in
the
drug ecstasy. What are some of the other street names for it?
X. I mean, but most people know it as ecstasy because that's, and it's a rave drug, which is exactly the worst.
And when you say it's in a rave drug, that people take it in a party atmosphere with a lot
of stimulation. The whole point of the experience with psychedelics is getting back to set and setting. So when we talked about the trials with MDMA, it's all about set and setting, because the set is to prepare the person for the experience. That's what these 3 or 4 months of sessions before you then do take the MDMA is to set the experience for the person, so they're not fearful of it, and to get some idea of what may come out of the session. And then the setting is generally just the opposite of what a rave would be, which would be flashing lights, techno music, tons of people, everybody's sweating because it's a sympathomimetic, and so it's a quiet environment. Oftentimes
in the medical setting, that's what you're doing.
That's correct.
But we know of it from its use in the current setting and a rave, a party atmosphere.
And that's right. And that's
is it Schedule 1?
Yes.
Okay.
But it'll be the first drug to come off Schedule 1, probably mid next year, and it will be almost certainly approved for use for recalcitrant major depression and PTSD. And I'll tell you who one of the biggest drivers for this are: VA psychiatrists. So. And this is one of the things that just kind of angers me, which is we could be done with this already. We could have finished the research on psychedelics, except for a bunch of grandstanding by people who just were trying to make some sort of pseudo moral point. Because that's a real sad thing. We've lost 60 years, and these were drugs that could have been used. But anyway, okay, we can go back to the list.
And then the second one,
psilocybin, which is generally everyone knows as magic mushrooms. This is probably the second agent that will come off the Schedule 1. It can be synthesized, as I said, I think earlier. The form that would be used in the medical environment will undoubtedly be a synthesized form. But there are people out there growing it,
and it's a real mushroom.
It's a real mushroom,
it's a fungus,
right?
It's people who can you find it in the wild, or
you can, but I'm one of those people who I wouldn't know one mushroom from another. And the last thing I'm going to do is take something I found outside. But yes, actually, of course, you can go online and procure, something to grow in your basement. It's not legal, but we clearly know people are doing this because it's happening all over the country right now. LSD is a synthetic.
And what do you know?
It was synthesized in the 1930s.
It was supposed
to be doing something else. I can't remember what Hoffman was trying to do with it, and he just found out it had this side effect. That's kind of one of the
Harvard folks, the Timothy Leary and the guy who became Ram Dass. I can't remember his name.
Oh God, yeah,
he was a professor as well. But these were professors at Harvard.
Yeah, actually, that's right. Because I know
doing some research.
I know somebody who went off with Ram Dass to India as one of sort of his inner circle. Yeah, I mean, he was a Jewish guy, I think, from Boston, probably New York. But anyway, LSD has a lot of research that was done earlier, not as much going on right now, but it will, I suspect, especially if psilocybin comes off Schedule 1, I suspect that would be the next agent. And then ayahuasca.
And that one, that one, having watched the Netflix movie, they focused on the folks with incurable cancer and using it like even as a one-time experience to become less fearful of death and sort of more accepting
That's correct.
of death as part
Although
of the life experience.
Although psilocybin has been used in that same role in some of these studies, they're probably the closest. Psilocybin lasts a shorter time, which may make it more useful because, you know, an LSD session could last you for 6-8 hours. So can the psilocybin one, depending on the dosing.
In the Netflix, it's a sweet little grandma who's getting her dose of LSD in a very controlled medical setting.
And that goes back to what we showed before, which is that the reprogramming of the brain, the opening of these connections, which appear to stay open, can occur with just one session. You know, and some people refer to it as you know, shaking the snow globe. You know, so yeah, you know, you open up all these connections, and then you just wait to see where it settles out. And some of these pathways stay open because they are viewed by the brain as beneficial. You know. So you don't necessarily have the psychedelic experience again, but you have the advantage of those connections being open. That sort of having, and what comes to the sessions specifically, I think it's great to talk about the ones about the end of life sessions. What comes to those sessions are that almost everyone comes out of those sessions, whether they are religious in any way or not, seemingly describing something that they do not fear anymore. You know, it's not necessarily the same vision of what the other side looks like, but although the traverse to there can be somewhat fearful, once you're there, people are no longer scared by it. And I think it goes back to something, you know, that you brought up, which is some of this is hardwired into our brain. It's coded into the DNA.
Not go gentle into
this. You know, it's
we're wired to resist the idea of death.
But we're wired to resist, and that, you know, the reason we're wired to resist the our death is probably the primacy we give to ego, because it's destruction of self. Whereas the experience of psychedelics is to dissolve yourself. You merge essentially into this other energy, you know, kind of in the Buddhist sense, you know, of energy. And so what fears death is the ego, which defines us as discrete. But once you have experienced not being discrete, then you don't seem to fear as much, you know, your corporeal mortality.
And then there was one other listed there.
Ayahuasca, which is the traditional hallucinogenic tea. I don't think anybody's going to be, you know, patenting that. I think that's kind of going to stay on the outside for a bit of time. Although it is, as I say, it's pretty available at this point. It's not unusual to find out your friends just spent a weekend in Vermont on this place run by this guy who used to be an addict and now runs a church of ayahuasca, basically. So, and, you know, some of this is real trendy, and some of it is and
that's why we need research.
Well, that's correct.
Because a couple of anecdotes of good trips
exactly
does not make.
Well, the majority of trips we seem to find out when they're appropriately set up are good trips, you know, and I think that one of the things people are trying to do, I mean, this was the article in the Times about, is to microdose, you know, microdose, particularly psilocybin, by cutting the mushroom up in smaller pieces and sort of seeing what happens. The problem when you microdose is you cannot eliminate the placebo effect, which is the kind of person who's going to grow mushrooms illegally and then cut them into little pieces to try to figure out whether they can find that sweet spot is already impelled in some way, inclined to believe it works. And so, for instance, the trials with MDMA used Ritalin as a placebo, which has an effect that would make somebody think that I got something. Drug. That's correct. And so that's the problem I have with microdosing. Some of the researchers with LSD have researched over the years to find their sweet spot, which is when they're not in a hallucinogenic, you know, experience, but they are clearly seeing their mind be more open, more capable intellectually, you know. And so you do develop a tolerance if you're doing, you know, psychedelics daily. So that may be a problem, because most of the studies in terms of safety are based on doses that are, standardized and not escalating because of tolerance. And again, but it goes back to your question. Could you use it once and get all its advantages? Absolutely. Could you use it 3 times like they do with PTSD and get the advantages? Absolutely. That's going to be a far better thing than making it, than medicalizing it. Because microdosing is just like, I'd like to take, duloxetine or something, or Prozac, but it gives me bad side effects. So I'm going to use this instead of taking that pill. It's unlikely that microdosing is going to have the same benefit.
Right. And so one of the thoughts is that this may not be, you may not have lots of commercial companies coming in wanting to make this if one dose in a lifetime does the job. It's not as effective as
Absolutely.
take this every day for the rest of your life.
Then that is an excellent point. That's correct. And it's kind of like orphan diseases. If there's only a small number of people with the disease, it doesn't really pay to do all the research, although the government pays for most of the research. But anyway, to do that research, if there's not a big market, and you're absolutely right, a one-shot deal for someone at the end of life is not a lucrative situation.
So, Charles, are you aware of what studies are going on right now in the United States or in the world? Let's say elsewhere where they aren't as restricted by this.
I mean, there are studies for all sorts of disorders. A lot of them, the majority of them, are around what we've already talked about: depression, PTSD, end-of-life scenarios, addiction, non-opioid addiction, for which there's nothing. And that's another situation where instead of taking a drug like Suboxone or methadone for the rest of your life, basically just substituting one addiction for another, but an addiction at least with which you can function and have a full life, you once again may be able to use a psychedelic a limited number of times. And
maybe I misunderstood. Did you say for opioid addiction or non-opioid addiction?
It's been looked at predominantly at this point for non-opioid addiction. It's been looked at for all sorts of obsessive behaviors, binge eating disorder. It's being looked at, for those sorts of things. So it's a very wide open field right now. But I think, the concentration here in the United States right now is let's get these off Schedule 1, which would then allow us to do real world research. Because as you know, in trials, everything looks like it works great. And then as soon as you put it in the community and it becomes generalized to a non-select population, sometimes things arise. And so, for instance, when MDMA comes off Schedule 1, it'll be under a REM, a research monitoring program, so that if you are administering it as a physician or another, certified provider, you are going to have to accumulate the experience of your patients and, submit to FDA so that we can aggregate all that experience and find out, are there problems with this?
Right.
So
I want to open it up to questions soon. Do you have anything else you want to tell us before we open it up to questions?
No, I mean, I really think that this is, I'd really emphasize that this is an opportunity for humanity to look at consciousness in a very, very different way, and to stop giving primacy always, as we do, to ego and intellect and everything else. That is just what evolutionarily the brain has picked out as a predominant form of consciousness. But there's all forms of consciousness, and there is value to be able, as we're seeing, to traverse back and forth between different forms of consciousness.
Okay. Let's open it up.
Sure.
We've got a live studio audience here with questions. And those of you that are watching us live streaming right now, if you could put your questions in the chat box.
Oh, okay. I'm lost and blown away because I wasn't prepared for what I heard tonight. And I heard this Netflix movie that we can see to review. It's called Netflix Psychedelics.
No, I think it's called Change Your Mind. The same as the book.
Mind.
I think it's the same as Pauline's book.
Okay.
Yeah.
Change
it's a
Your Mind.
4-part documentary. Yep.
Okay. So my real question is, I mean, I'm kind of looking in my mind your slide where you had one side your normal brain and another side on psychedelics. It seems to me when you're on psychedelics that it makes you smarter, makes you more aware. Is that true? Does it make you
I
smarter?
would say a
Can you
better
think
description.
better and work better then?
The after result is that people will report more creativity, more clarity, and elasticity of thinking that tends to go away as you get older. For instance, the number of neurons and the number of interconnections in your brain peaks around age 7. It's downhill all after that.
You said age 7?
That's correct.
7 or 70?
7.
7.
7.
Wow.
It's not that you're not smarter, but your brain, the brain and evolution favors efficiency. It's not efficient to have all these interconnections. So the beauty of psychedelics is that it shows the brain how to get to these other places. It doesn't keep the brain in that state at all times. And once you know how to get to that place, then you're able to access this again. So it makes up for the increasing obstinate nature of our ego and our aging mind to just keep doing things the same way you've always done, because that's the most efficient way to do it. We become creatures of habit, and our thinking becomes habitual. And sometimes that works, and sometimes it doesn't. So, everyone remembers the Beatles went off and dropped acid over in India, and they all came back, and they felt they were much more creative. I mean, you may feel differently about it. I don't know. I was never a big fan of the Beatles, but yes, people do feel like, and that's the beauty of the patients with PTSD. They may just need to do it a couple of times, and they see their way to a new place.
Yeah, I'm sure it's not the same, but there's something to be said for getting out of there's something to be said for going on vacation, for getting out of the same thing you're doing and to go to a place where you have more time to think differently, and that can kind of be refreshing.
Mhm.
So wouldn't it be easy? Wouldn't it be nice if you could do it in a controlled setting and in one session, and as opposed to needing 3 weeks of hiking through the Himalayas to see the world in a different way?
I'm not sure I would equate those experiences.
Okay.
Because I would want to do both. But I one of the things, my partner's a Buddhist, and I've kind of come to really feel like it's the one religion I can kind of be with, and the notion of Buddhism is about a communal energy that we all participate in, right? And I understand people say, well, in practice, Buddhists, discriminating against others too. That's fine. But what the religion is talking about is a universal energy, and that we all participate in this universal energy. And then you cycle through corporeal, through multiple lives. And in each life, you pick up knowledge. Well, the problem I've always had with, the notion of you live once and then you go to some sort of destination is, okay, now you have this knowledge. What good is it up there or wherever you are? And the idea that the brain has this information in it. That's what's really kind of unsettling in some ways about it. It's there. And, Dick was talking about the plant thing, there's an element in the practitioners of the use of psychedelics talking about the plant in the same way a homeopath says, I'll take a small bit of something, shake it up, and the essence of it is in there. And then you take it and you participate in the essence, because the essence is coming from the same place that your cognition, that your existence comes from. And I know this, again, is probably getting way beyond where you want to go, but this is where people end up who are researching. They're not just looking at the pharmacology of it. They're asking the true question of, I'll put a simple question to you. When you're a child, they tell you that if they show you an apple, what do they tell you? This is one apple, right? You send a child, and then there's 2, and then there's 3 apples. But there's the subtext of this is, how do they understand that the apple itself as a unit is somehow discrete? You're not taught that. That's knowledge and or consciousness that you already have in you. You understand the discreteness of things. At the same time, what we're talking about here is losing your discreteness to participate in knowledge that's actually more universal to all humanity. And I know you probably think, oh, this is stuff that's written by a bunch of,
a bunch of Jewish guys from New York City.
Right. But it really isn't. I mean, what's startling about this, I mean, you can read Huxley and others, but if you read the researchers and what they're writing, these are hard-nosed scientists. These are brilliant scientists.
It will be interesting to see where the research goes. And, is there some essence of this that we can't quantify,
I think that's the whole point.
With an MRI scan or with a blood test and your level of this or that.
But
and so how do we quantify? And then that's one of the problems with, mental health.
Mm-hmm.
In the cancer, you've got a tumor, you measure it, you do a treatment, and then you measure it again. And there's sort of this very easily understood objective change that happens.
That's true. And that's how we were trained. We were trained to a deterministic cause and effect type of thinking. But the fact of the matter is I'm even before this, I'm a big believer in chaos theory. Okay. Not like the Jurassic Park chaos theory, but that existence is a probabilistic game. The gene is a probabilistic entity. And in fact, the mind is a probabilistic entity, because what it does is it interprets the environment in a way that says this pattern, what I'm seeing, I funnel it down, and what I see fits a pattern that makes it most likely that I'm looking at is somebody's face. But it's a probability game. And I agree with you. I'm as much in it as you are, because especially a surgeon,
well, we interesting
very concrete.
Where the research leads us as we start doing the research. And
but that's what the functional MRI, that's what's amazing about the functional MRI is it's showing what parts of the brain are suddenly turning on and off.
Do we have any questions from the live streamers? Okay,
sure.
Dr. Goldman, maybe I'm suffering from the stereotype, but I've always been struck by the dichotomy of psychedelics going back. I'm almost as old as Dr. Deming, but going back to the 60s and 70s.
You and I are probably the same age.
Yeah. And that is the people that used to seem to do well on psychedelics were the people that had self-confidence, the people that were not fearful, the people that seemed to do poorly, at least in my mind, or most at risk for taking psychedelics were people that suffered from fear and trepidation. Yet they were the ones that maybe needed it the most, that had the most to gain from it. So I just wanted you to speak about that dichotomy. Is it real?
Yes, and that's actually part of the reason that the research has been very fastidious about setting up your sessions. Don't just have one meeting, investigate just those fears. And that's the reason why psychedelics got a bad reputation, was that when people were using it recreationally, there were plenty of people who had, first of all, underlying mental illnesses, perhaps that, did not favor use of psychedelics. For instance, schizophrenia shows up usually in late adolescence, early 20s. That's the time when, certainly in the 60s, that was the age of a lot of people who were experimenting with psychedelics. That's not the best person to be taking psychedelics in an uncontrolled environment. So you're absolutely right. We know that in an uncontrolled environment, the side effects, the possible complications can be much more difficult to manage. But while we don't want to medicalize this, it would be the safest way to make these agents useful. And so, yeah, I think you make a good point.
Great. Well, thank you, Charles. And any of those that you're in the room and want to talk with Charles about other aspects of palliative care after this lecture closes, please, I invite you to come up, because some people, we put on the title of this as palliative care, and I think some people thought, but this is great, Charles. I really appreciate it, because part of the purpose of this video podcast is to expand our minds,
right?
And even if it isn't by ingesting something, but I
and that's doable. I don't want to make it seem like this is the only way to do that, but
This has been great. Thank you, Charles, for all
Well,
you do
you're
for our
welcome.
patient. Thanks for being with it. We'll have you back again. And for those of you watching, if you know someone who might benefit by watching this, it will be available on the Above and Beyond Cancer YouTube channel beginning tomorrow, and it'll also be available on the MercyOne Cancer Center website. So that's will allow anyone to watch at any time. Please join us again next week. Thanks everyone for coming. Bye-bye.